number of COVID-19 cases continues to rise globally and right here in Guyana. Therefore, we encourage everyone to practice social distancing. Wear a mask if you have to leave your homes and wash your hands thoroughly and frequently as we strive to stop the spread of the virus. Welcome to InfoHub for Thursday, April 30th. Thank you for joining us. Georgetown continues to be the epicenter of coronavirus cases, with some 50% of the positive cases emanating from several areas in the city. Minister of Public Health, the Honorable Valda Lawrence, made this announcement and called on persons to heed the advisories as she updated the nation on Wednesday. Here is our first report.
A large number of coronavirus cases in Guyana are from densely populated areas in the city. Local transmission is the main cause of the large number of positive cases since imported cases were last recorded as 4.
Central Georgetown continues to be the epicenter, with the positive cases identified coming from the following communities. In the north of Georgetown, Kitty, Sophia, Turkine, Liliandal, Cummins Lodge, Albertown, and Cumminsburg. In the south of Georgetown, Border, Lamaha Park, South Rhymeveld, and Thirst Park.
With cases emanating from these areas, Central Georgetown records more than 50% of the total coronavirus cases. Minister Lawrence, in giving an update on April 29, said simple adherence to the precautionary measures could have avoided this. She used this opportunity to implore citizens to adhere to the health guidelines before the situation gets out of control. The measures, which include adherence to the curfew, staying at home, and sanitizing, continue to be touted in an effort to contain transmission of the coronavirus and flatten the curve. As of April 29, Guyana recorded 78 positive coronavirus cases with 8 deaths. To date, 18 of those positive cases have recovered, while 52 remain in isolation. For InfoHub, Delicia Haynes.
Guyana is a food-secure country, even as it battles the novel coronavirus. This assurance was given by Minister of Agriculture, the Honorable Noel Holder, to the Inter-American Institute for Cooperation on Agriculture during a recent virtual meeting. The Inter-American Institute for Cooperation on Agriculture recently facilitated a virtual meeting for agriculture ministers of the Caribbean community with the aim of establishing a common sectorial strategy to address the crisis brought about by COVID-19. In his presentation, Minister Holder noted that while it is too early to arrive at an accurate assessment, the slowdown of the economy will affect all aspects of food security, that is, availability, accessibility, stability, and consumption of food. However, with Guyana producing approximately 60% of its own food consumption, the country remains secure. Minister Holder stated, quote, Guyana is a food-secure country, having met global targets in 1996 of the World Food Summit and in 2000 of the UN Millennium Development Goals. End of quote. While agriculture input supply services are operating at normal levels, they could be impacted by international trade restrictions. Baby chicks are usually imported from the USA twice per week. Should there be any disruptions to this, Jamaica has indicated that they will be able to supply the entire region. Minister Holder noted that Guyana remains a food-secure country, and in the context of the current situation, international partners could assist in examining ways in which food could be moved across borders to other countries within the region. The virtual meeting was attended by the agriculture ministers from Antigua and Barbuda, Bahamas, Barbados, Dominica, Grenada, Haiti, Jamaica, St. Kitts and Nevis, St. Lucia, Trinidad and Tobago, St. Vincent and the Grenadines, Suriname, and Guyana. Each country was allowed to present on the conditions and needs of their respective country's sector. A partnership between the Civil Defense Commission and the Guyana Council of Organizations for Persons with Disabilities will see some 750 individuals benefiting from relief hampers during the current COVID-19 pandemic.
The Commission commenced its series of distributions on Thursday morning. Among the first organizations to benefit were the Guyana Society for the Blind, Gifted Hands Learning Center for Special Needs, the Guyana Deaf Association, and the Vocational Training Center for Special Needs.
So this will be a great assistance because persons with disabilities, like other Guyanese, they have been severely affected, but Because persons with disabilities most of them are unemployed, living in poverty, they're even more affected because of this COVID-19 crisis. So this is a great help.
Ganesh Singh, Program Coordinator of the Guyana Council of Organizations for Persons with Disabilities. He told InfoHub that over 752 persons with disabilities who are affiliated with the council will receive the hampers. According to Marcia Smith, founder and principal of Gifted Hands Learning Center for Special Needs, the donations will be a blessing for her 24 students.
I want to say thank you to the government of Guyana, CDC, for honoring my application for the persons living with disability, my students here at Gifted Hands, and I know it will benefit a lot.
Meanwhile, CDC's Director General, Lieutenant Colonel Kester Craig, explained that the Commission has been in communication with the organization for the past 2 weeks to identify the group of beneficiaries.
And today we started a series of distribution to over 18 organizations that represent people living with disabilities to give them these supplies so that they could relieve some of the impact that persons are feeling, especially this vulnerable group in.
For InfoHub, I am Kellon Rover.
Meantime, the University of Guyana is providing care packages to students, staff, alumni, and pensioners through its UG Cares initiative. Leticia Isaacs tells us more.
Professor Paloma Mohammed, Deputy Vice Chancellor for Philanthropy, Alumni and Civic Engagement, explained that the initiative was formed after several staff and students expressed the need for assistance. Also in direct focus are students and alumni who are on the front line supporting the national COVID-19 efforts.
A number of our alumni are on the front lines, and we wanted to make sure that if they were doctors, nurses, all these people, if they were actually experiencing any kind of problem, that we could help.
Leanne Kendall and Debbie Hopkinson, lecturers of social work and psychology, provided a way for their students to do their end-of-semester impact assessments in the absence of final examinations. The operationalization of the activity is pegged to the objectives of their courses. Norwell Hines, Technical Officer Civic Engagement, noted that UG is inviting students and staff who are interested in being a part of the UG Care system to register their interest at tinyurl.com/UG-cares.
We will dispatch to you at the mobile number that you give us a coupon code that is linked to your information, your form that you submitted online, and that coupon is sent to you by SMS. You can then show that code to the supermarket that is willing to accept our credit line, and you get the package of items that are already been worked out.
The university is providing aid in 4 main categories, namely masks and other safety supplies, abuse and crisis support, cleaning and hygiene supplies, and foodstuff and other nutritional supplies. The nutritional care package includes food items like milk, sugar, flour, rice, butter, eggs, cheese, oil, soap powder, methylated spirits, bleach, toilet tissue, and masks. Other measures UG is taking to support students, staff, and the wider population include psychosocial support through several hotline numbers, community-based communications to improve awareness and understanding of the virus, and educational support for children living in care facilities run by the Ministry of Social Protection. Leticia Isaacs for InfoHub.
More news after this short break. Stay with us.
A face mask only works if it is put on, used, and removed properly. Before putting on a face mask, please do remember to wash your hands with adequate soap and water for at least 20 seconds, or use a hand sanitizer with 60% or more alcohol. This is an N95 face mask. Check your mask for holes and tears. Identify the top of the mask. Cup the mask in the palm of your hand with the metal strip at your fingertips and the elastic bands hanging loosely. Position the mask under your chin and covering your nose. Place the lower strap behind your neck. It must touch your neck. Place the upper strap to the top of your head. Untwist the straps. Use both hands to mold the shape of the nose piece by pushing downward and outward. Perform a fit check by checking the mask to see if there are any air leaks. Do not lower your mask to speak. You must not touch the front of your mask. If you do, then wash your hands immediately. When removing the face mask, remove the bottom elastic from behind, then the top elastic, ensuring that the elastic straps do not snap. Once again, do not touch the front of the mask. Throw the mask away in a bin with cover. Do not forget to wash your hands immediately. Remember, if your mask gets damp, replace it.
Welcome back and thank you for staying with us. The Secretariat of the Guyana Elections Commission this morning commenced the training of some 80 officers who will be participating in the national recount of the March 2, 2020 ballots at the Artichon Conference Center. Public Relations Officer Yolanda Ward said the training is based on the recount's work plan, an order which is yet to be gazetted. The one-day training will appraise staff members on the methodology for the recount as well as their respective responsibilities. GCOM will be utilizing 10 workstations for the national recount, 8 of which will have 14 persons each, and the remaining 2 will have 10 persons each. The COVID-19 pandemic has forced persons to make changes that are in the best interest of the health and well-being of their family and friends. But how do we cope with the challenges that may arise during this time that affect our mental health? Hear how in this report.
As a result of the coronavirus pandemic, we have made drastic changes to our regular lifestyle in the best interest of protecting ourselves, family, and friends as we all are at risk. Mental Health Unit Director at the Ministry of Public Health, Dr. Util Richmond Thomas, said that with all these changes, it can be challenging to adapt to a new lifestyle.
Staying at home with families, wearing a mask, washing our hands regularly, finding new hobbies and routines have now become the new norm. Many of us are finding it hard to adapt. The stress associated with this period is manifesting in different ways for some of us. Lack of sleep, constant fear, anger, confusion, frustration, anxiety, depression. All these things are what we face daily.
She therefore outlined some tips as to how we can cope with all the challenges that may arise during this period.
Stay connected with family, friends, workmates, and whatever clubs, organizations, or social groups you may belong to. Fulfillment of basic social needs such as love, belonging, and connectedness brings a feeling of security and contentment, which is very important in preventing depression. Exercise, sleep and eat healthy every day. These are powerful stress busters and natural antidepressants.
It was also advised that persons embrace a positive attitude, which the mental health director says will go a long way as your problems will become manageable, giving you hope and confidence to get through this pandemic. For InfoHub, Delicia Haynes.
Among the series of COVID-19 relief measures granted by the Guyana Revenue Authority, a 3-month waiver of value-added tax on electricity has been added. Shaquille Bourne brings the details.
To the benefit of all customers of the Guyana Power and Light Incorporated, GPL, the VAT exemption that has been implemented will take effect from April to June for prepaid customers and May to July for postpaid customers.
Okay, so the prepaid customers, because their consumption is immediate, they will see it reflected in their consumption for the period April to June. Because of the shortness of time, it wasn't possible for GPL to prorate the exemption. So for those postpaid customers, they would not have seen it reflected on the April bill. So they will see it reflected on the May, June, and July bill. So no consumer is going to be benefiting from it for more than 3 months.
Manager of GRA's Public Relations Unit, Melissa Beard. VAT is usually applied to electricity consumption of $10,000 or more. With more citizens at home in light of the emergency measures, the tax exemption was instituted to cushion the economic impact of the COVID-19 pandemic. Shaquille Bourne, for InfoHub.
Remember to do your part to ensure you do not put yourself at risk during this time. If you have a cough, fever, and difficulty breathing, seek medical care early, but call the hotline first. DPI would like to take this time to extend greetings to all our Muslim brothers and sisters as they observe the holy month of Ramadan. That's all for today. Connect with us on all our social media platforms, including WhatsApp, Facebook, YouTube, and Instagram, as we bring you the latest and important news related to COVID-19 and much more. Also, subscribe to our website, dpi.gov.gy. Your Bridge Report is up next. Stay safe and goodbye for now.